be launching our analysis along with the workbook so that others can use it to do their own analysis. All documents can be found on the website CCPA, www.policyalternatives.ca, or the college's website, which is nscsw.org. I am joined today by my co-authors, Dr. Christine Saunier and Dr. Tammy Finley. Christine is the Nova Scotia Director of the Canadian Centre for Policy Alternatives. Tammy is an Associate Professor and Chair of the Political and Canadian Studies at Mount St. Vincent University and a Research Associate of CCPA-NS. Before we go any farther, I want to center on a critical principle of the social policy framework, which is decolonization, by first acknowledging that we are all here on unceded traditional territory of the Mi'kmaq people. We are all treaty people, and it's important that those treaties are honored. What that means going forward is that we need to repair our social safety net so that Indigenous communities have control over the social policy that impacts them and have the support and funding necessary to provide for the needs of their people. It's been reported that no Indigenous communities in Mi'kma'ki have had any infections of COVID-19. Kudos to them. The support necessary to contain the spread also needs to extend to those in urban areas outside First Nations communities. Since no race-based data has been released at this point in time, it's difficult to know the impact on urban Indigenous and those who do not live in an Indigenous community or in any other community, including African Nova Scotians community. A question has already been asked to CCPA-NS about race-based data collection. This is something that we need to ensure to make sure that our analysis is both evidence-based and intersectional. This means that we need to have the data that allows communities and governments to make informed decisions using these principles. The concerns about the impact on Indigenous communities at the beginning of the pandemic may not have materialized yet in Nova Scotia, but the conditions that put Indigenous communities at higher risk must still be addressed. What we have seen over the past 3 decades is an underfunding of health and social services, crowded housing, and high rates of poverty, lack of potable water because of racism and colonialism. Both have created challenges for Indigenous communities to take care of the health and well-being of their community members. Our governments must honor the recommendations of the Truth and Reconciliation Commission and follow the principles of the United Nations Declaration of Rights of Indigenous People and work collaboratively to ensure that Indigenous communities have the right to live in freedom, peace, and security as distinct peoples, and the right not to be subjected to any act of genocide or any act of violence through the pandemic and beyond. Before I turn over to Christine for a brief overview, just a reminder that if you have questions for us, please ask your questions on the Facebook comments. And our esteemed colleague, Govind Rao, who's the CCPA Research Advisory Committee Chair, will be monitoring those Facebook questions and sending them over to us to watch. I'm going to pass it on over to Christine now, and I appreciate everyone joining us today.
Hi, everyone. Thanks so much, Alec. And thanks to the Nova Scotia College of Social Workers for continuing to partner on this important work. I do want to begin by acknowledging, and I will say that some of what we are doing today is acknowledging and stating, taking stock of where we were at, and first acknowledging that this is first and foremost a pandemic. That means it's the worldwide spread of a new disease, and in this case, the coronavirus. So I do want to begin by sending our condolences and thoughts to the family and friends who have lost loved ones to COVID-19 in Nova Scotia. We want to also acknowledge the difficulty facing the staff who have lost patients and thank them for their hard work as they continue to provide care, put their own health at risk, and support those who need the support. And in starting there, as of, I think, late yesterday, and the numbers change obviously as they are reported, we know that 57 people died in our province. We know that there are still at least 88 active cases, and I say at least because without widespread testing, especially of those who are not without symptoms, we really do not know the extent to which this has infected our population. As a province, we know we have the 4th highest rate of reported cases per million in the country. We also know that the majority of deaths occurred in long-term care, not just in Nova Scotia, but across the country. In Nova Scotia, 55 out of the 57 deaths were residents in a long-term care facility. We also know that 51 of those deaths occurred in Northwood. This is the province's largest nursing home, in fact, one of the largest nursing homes in the country. And I actually want to shout out to independent writer Nora Loretto and her work compiling data across the country. To say thank you to her, but also to flag that she is an unpaid independent writer, compiling data that's necessary for us to have the evidence needed to move forward. And her evidence shows us that, in fact, Northwood has the 11th highest death rate for a single long-term care home in the country. And so what I want to say is, obviously there's lots of red flags in what has transpired in Nova Scotia. We are waiving some of them today. Certainly, we would say there has not been enough transparency coming from our government. There is definitely a lack of data and information, not just on the coronavirus itself, but on the full impact of COVID-19. There is a lack of opportunity, in particular for our elected representatives and broader community to ask questions. Look, we are not here as epidemiologists because we are not that. We are not experts in public health. That is not the focus of our report. We totally, absolutely understand that public health and evidence related to the disease must lead the way. But our governments are responsible for making decisions about how to support people to follow that evidence. That there are stark differences on both fronts, even amongst provinces in Canada, let alone countries around the world, means that the precautionary principle should be used as the way forward. This report also, does not delve into the epidemiology questions, nor does it talk about the economy in an abstract way, and we reject the idea that we are reopening by supporting business to somehow do this magic thing with an abstract economy. As Alec, Tammy, and I will talk to you today, we will be showing how the principles in our social policy framework can and should be used to develop solutions. The framework contains 10 principles, plus the overarching requirements that all solutions be evidence-based and intersectional. Tammy will be talking more about the intersectional part. It is important to understand how these principles and solutions are interconnected and critical to forging a new path forward. We cannot return to normal. This report, however, is not a detailed reconstruction plan. That is something that we are working on. This report is primarily focused on understanding how COVID-19 has affected the people in the province and why its impact is being felt differently by people. We are specifically focused on government's roles to provide a social safety net that supports collective well-being in the best of times and especially in the worst of times. So let me illustrate. The tragedy that has unfolded in Northwood absolutely must be a wake-up call. Our long-term care facilities have been underfunded, both when it comes to adequate staffing and related supports, as well as infrastructure. Applying our framework to what is happening would mean that the best solution is for long-term care to become part of our publicly funded universal healthcare system. But that is just part of what needs to happen. The state of long-term care, it's also related to the state of home care and the broader preventative and primary care services, including our hospital-based healthcare. And that is all related to the broader conditions in our society, how all people in Nova Scotia must be supported and deserve to be supported to live in security, enjoy good health, and participate fully in society throughout their lifetime. So if we recognize the interconnectedness, that is one of our principles, that is necessary for improving social well-being. What does that mean? It means our governments need to work across departments, that they can't work in silos. It also, we want to acknowledge that we need governments to be cooperating to ensure we get access to the public services and income supports we need. We have seen some of that happening, and that's a positive sign. The principle of shared governance is critical. The federal government is leading, as it should. Its role, in fact, needs to be strengthened going forward, with increased funding to the province as well as our municipal governments. And we need to hold our federal government and our provincial governments more accountable for the funding and how they use it, with national standards to address the patchwork of social programs that exist. Our provincial government has a critical role to play. Returning to what has happened in terms of long-term care in the province and across the country, if we want to support seniors, we need to support them to be able to age well. We need to make those investments upfront and all along the life cycle. We know that earlier life experiences impact how people age. We also know that gender, race, culture, economic, social, and environmental factors determine one's health and well-being in later years. If we were to use an intersectional lens and develop age-friendly solutions, maybe even become an age-friendly province, we would need to invest in barrier-free buildings and streets, affordable housing, well-paid caregivers and support, accessible and flexible employment opportunities, and expand public health care. Seniors benefit, we all benefit.
Thank you, Christine, for laying the groundwork for what this paper aims to achieve. Again, it's really critical that we understand that we make decisions as a government, or the government makes decisions based on data and information and ideas that are out there. And our idea is to continue to convey these ideas and these principles that are going to lead to the outcomes that we all want. But before we get into more detail about that, I do want to come to Tammy and ask, what do we need to understand about the province before the pandemic hit in order to better respond in months ahead and to develop a roadmap for reconstruction in the years ahead?
The broader impact that measures to stop the spread of COVID-19 are having, and the impact that they will have in the medium term and moreover in the long term, are because of the state of things when the pandemic began. Caregiving, public services, and democracy have been undermined in our province for quite a while. We went into this pandemic with a shortage of family physicians and healthcare in crisis, with people not being able to access the prescriptions they need, the mental health supports they need, and more. When we come out, how will we deal with the backlog of non-essential health services on top of all of these other challenges? And we went into this pandemic with a public education system that needed funding to equitably support its students on site, but also many of our students' families needed support to meet their basic needs, let alone do homeschooling. We went into this pandemic with people struggling to find and keep affordable housing and lots of people facing significant housing insecurity. Once the tenancy board is back up and running, we're likely to see a raft of evictions because people won't be able to pay their back rent. They may not have been able to pay when they lost their jobs or most of their hours. Urgent action is needed, including rent forgiveness, extending the moratorium on evictions, and rent control. Our province went into this pandemic with high rates of poverty and food insecurity, and with 80% of our food being imported. Providing more funding to food banks does not solve that problem. We need to lift people out of poverty first and foremost. That bottom-up support will be the best thing we can do. We went into this pandemic with a significant portion of our workforce making very low wages. Approximately 30% of our workers earn less than $15 an hour. And what the pandemic has revealed is that these workers we rely on most have been paid the least, from food processing workers, grocery store cashiers, warehouse workers, couriers, long-haul truckers, to those providing care in home care and long-term care homes. They have always worked hard, and during the pandemic also put themselves at greater risk. Some of them have received pandemic pay. They all deserve a significant and permanent raise. So Alec, about reopening, many parts of the Nova Scotia economy have been open. we have had one of the narrowest closures of non-essential workers, of non-essential workplaces. What the next phase must focus on is how to ensure that all workers are supported to work safely and with the supports they need, including personal protective equipment, paid sick leave, stronger labor standards, and other mechanisms to refuse unsafe work. Once the state of emergency is rescinded, workers in Nova Scotia not covered by a collective agreement are legally only able to take off 3 unpaid sick days. If we are no longer going to tolerate even a sniffle, we must put protections in place, including more proactive inspections. If workers are protected, so are those they serve, thus instilling confidence in people who are willing to make a purchase or use those services. And if some workers are able to continue to work from home, they also need proper equipment, training, and support at home. Let's not forget that there is no opening without workers, and many workers need childcare. There's a serious lack of affordable, quality childcare before the pandemic, and now when we absolutely cannot open to capacity, with rations that existed before, ratios that existed before. Given that we know that more women have been laid off or lost a majority of their hours, we must ensure that women are supported to return to work. This is not a recession like we've seen before. Indeed, we argue that this is an opportunity to do things differently and make things better, addressing paid work, unpaid work, and otherwise. We must prioritize decent work and well-being, one of our key principles, and consider options, including a shorter work week. Finally, Alec, the reconstruction phase that follows the pandemic must be just and fair, and it must prioritize climate justice, another of our key principles, ensuring that the costs do not fall onto marginalized communities and that these communities benefit equitably. A just reconstruction must be seen as an opportunity to invest in green infrastructure related to energy, and also to invest in social infrastructure, including childcare, and in jobs that strengthen our collective well-being and are also not environmentally destructive. So caregivers, artists, and educators, for instance.
Thank you for that, Tammy. I appreciate you laying the groundwork there. I want to come to Christine again and ask, we're constantly hearing from media, from our government officials, that we are all in this together. And we hear in we hear in language too that language around family bubbles and income supports in these other areas. This language that we all seem to be starting from the same place. But can you explain why this pandemic is impacting people differently?
Absolutely. The reality is that we obviously are not all in this together, and some of why we aren't is what Tammy just laid out, is where we were and when the pandemic was declared. And that means that some of us are much better positioned than others to weather this crisis. The reason we developed the framework was really to lay out what is needed to create a system where we are actually in it together, to build social policy that really is about building solidarity and collective well-being. So by using an intersectional lens, by considering all of the evidence available, we ensure that we actually center the experiences of marginalized communities. So social policies have to account for the multiple and interconnecting ways that power and privilege are not evenly shared because of factors such as gender, race, ability, sexuality, age, or geographic location. If we then use the principle of intersectionality and we apply that analysis to the pandemic, we see, for instance, that women workers have borne the brunt of layoffs and hours cut. Care workers and service workers who have been on the front lines are primarily women and often women of color. These workers who are caring for our patients, supporting the elderly, cleaning and disinfecting our institutions, and staffing our grocery stores. Whether working outside or from home, many women are also balancing their paid work with unpaid caregiving. While this was always the case, this was the case going into the pandemic, and it is more so the case right now. Now we see that this work has an additional dimension, and that is homeschooling. And of course, home is not always a place of safety. We know that women face an increased risk of domestic violence during this crisis. So related to intersectionality, one of the principles that must guide the solutions coming out of the pandemic from our framework is universality. What universality means, everybody will likely think about our universal public health care system. But that system itself has been eroded. We need to get back to universality, which really means that the services that are available, they are available to everyone, regardless of income or ability to pay, and they're funded through general revenue from taxes, not from user fees. When policies are designed to meet the needs of the most marginalized, they will also meet the needs of the most privileged, whereas the opposite is not true. Let's underline that. We meet the needs of the privileged, and we will not meet the needs of the most marginalized. But if we meet the needs of the most marginalized, we will meet the needs of the most privileged. With services universally available to everyone, we can ensure that the quality of services is high. That's what the evidence tells us. And that those who use the services are not stigmatized. And that those providing our services are well paid. That's some of the evidence we know around the importance of using an intersectional lens and developing universal public services.
Thank you, Christine. One of the things that has really stood out for me, and I think many in Nova Scotia and across Canada throughout this pandemic, is the strength of the public service when it is given the tools and the resources to do what it needs to do. And so there's a lot of rethinking, and I think a lot of analysis we can do from that as we move forward. I do want to just take a minute and ask folks who are watching us on Facebook Live, if you do have questions for us, start to get those geared up now and write them in the comment section so that we can continue on our schedule as we have planned. And I do want to keep the conversation going here and want to come to Tammy and ask Tammy, can you talk about why strengthening public provision of universal programs is key now and is going to be key into the restriction phase as well?
Sure. So Nova Scotia, really like the rest of Canada, relies a great deal on the private sector to provide our services. And by private, I mean the market, the family, which is often women, and charity. We've known for a long time that investing in public services would increase the quality of services, would ensure greater equity for users and providers of services, and improve accountability to citizens. The public health crisis has simply made this more painfully obvious and more broadly evident. Long-term care is, of course, the most blatant example, but our lack of public childcare, mental health services, pharmacare, and housing have also revealed themselves as major holes in our social safety net. In the reconstruction, these are precisely the areas where public investment will be absolutely essential. We will need caregiving support so that people can return to work. We will need a comprehensive healthcare system that covers mental health services and prescription medications. We will need to ensure that workers are well paid and that income is supported with both better wages and public services. It is important to recognize that not all communities have the same relationship with the public sector and public institutions. So Alec, we must bear in mind that the decolonization you opened with and social inclusion have to be at the forefront in our planning. And work toward citizen empowerment and not surveillance is also essential. This requires ensuring everyone has the supports they need, for instance, to self-isolate, rather than giving the police powers to fine people for not following protocols. Overall, a just recovery must be guided by intersectionality and prioritize universal public services.
Thank you, both Tammy and Christine. So I want to add a couple of points about ensuring that our policies leave no one behind by integrating the principle of social inclusion. Again, as a social worker, I want to talk particularly about vulnerable children and youth and their families throughout this pandemic. When we talk about, again, social inclusion, we're talking about what it means to engage folks and draw them into the broader community discussions that are happening around them. It means, again, making sure that no one is left behind, that their perspective is included in all of this. One of the things that we know has shifted during the pandemic is we've lost a great deal of community support, particularly for vulnerable children and families. As folks self-isolate at home, again, those supports from the school system, from after-school guidance, from food programs that are available, even to the direct social work support that they might be getting, in addition to wraparound counseling. All of those have been either lost or changed quite rapidly in this process. That makes a lot of us advocates for children and youth very, very nervous about what's coming ahead and what that could look like. And we've dropped the ball in a number of places in terms of ensuring that folks remain included in those discussions, such as access to technology, access to the proper income supports, food security has lagged as well. So again, as we move forward and talk about the needs for recovery as well as during the pandemic, social inclusion becomes a very important point and principle that we need to follow. Ensuring social policy solutions address the deeply rooted systemic barriers in our policy, programs, and services must happen during the pandemic and continue throughout the recovery. Social inclusion must be guaranteed for the users of public services as well as for those who provide those services to us. It requires that we advance both equity and equality. Immediate solutions to stop the spread and to treat those who have been affected must ensure that solutions work for the most vulnerable population. The institutionalization of people with disabilities must swiftly end, and folks must be provided with community supports so that they can continue to have the care they need. Home care must be funded as an essential public service. There's much concern about the homeless population and how quickly the virus could be spread. Jurisdictions have recognized the need to provide quality housing in order to self-isolate, and some of the homeless population have been moved into hotels. But we need to have a permanent solution to end homelessness. One of the challenges we're going to see is that we have moved folks into hotels, and they are experiencing often for the first time the dignity and the care that they deserve. What's going to happen when we leave this pandemic? Are we going to render those folks homeless again? Those are some of the discussions that we need to have, and we need to be embedded in the principle of social inclusion. And we need to make sure that governments are stepping up to the plate to address those major concerns. Children who have been placed in care must continue to have access to their parents in order to maintain bonds during the pandemic. Again, this is a major concern in terms of holding that attachment and maintaining those bonds. And again, when we look at the province and the inequity and the inequality that exists, particularly around that technology gap, having access to internet, having access to the tools to make those connections are all part of the solutions that come out of the principle of social inclusion. Again, the province must expedite the implementation of public health measures to protect residents of provincially funded congregated care facilities for people with disabilities. Must also fund what is necessary to provide people with disabilities with supports they require to live as independently as they can in the communities of their choice. In addition, the province should increase funding to nonprofit agencies to provide that care, service, and support to vulnerable populations during this crisis. Not-for-profits are well positioned in communities to know what the needs are and to draw folks into those conversations, but haven't been funded adequately to meet those needs. That's something that we need to change. And really, one of the most important protective factors that we need to be talking about during this pandemic is financial assistance to low-income Nova Scotians who currently can't afford access to the internet or have up-to-date access to the information that will build better inclusion. Again, when we look at where current income supports are, even with the additional supports that have been added, we're still well below the market basket measure. The extra $50 one-time payment for those of income assistance who are struggling to make ends meet will do little to support them afford the necessities needed to self-isolate. In addition, we have to remember too that we are not looking at schools returning until September. We're going to have limited access to daycares. That means that families are going to be self-isolated for the next little while. And so we have to ensure that income supports continue and continue to get up to that poverty line. Our provincial government needs to do much more to help those folks in need. This is not the time to be focused on deficits or our overall budget. Now is the time to be focused on investments in the social infrastructure and a shift to fiscal fairness, which is another important principle. Again, as Christine and Tammy have outlined, we are not all in this together. People have come into this from very different standpoints. And again, as we start to look at the data and see what's happening, those who have been privileged, those who have the financial means are faring better. And we'll continue to see that evidence as it becomes available. So coming out of this crisis and into recovery, we must ensure that the most vulnerable are included in decision-making and in our communities, and we have to strengthen our democracy. This is a core point and principle within our framework as well, is that the communities that are impacted, the social policy that is impacting them, they need to be part of the solution and involved in that solution. Not only is that a principle in our social policy framework, but that's a core principle of social work. Again, the idea of self-determination and empowerment that we need to be able to address. We're going to end our presentation there, and we're going to look for questions from those who are watching. And so I'm just going to look at my phone, and we've got a few coming in now. So the first question, sorry, just let me get access here. Much of the funding for services come from the federal government, yet they are reluctant to impose conditions on the provinces in the context of the federal-provincial politics. What can we do about this? And how can we get around this? And that was from Stella Lord. So I don't know if Tammy or Christine wants to take the lead on that.
I knew that was from Stella before you told us that. Thanks, Stella. Well, one of the things we were hoping to talk about as we wrapped up were some of the reasons for optimism. And I think actually you've highlighted one, which is that there is now increased interest in talking about the relationship between the federal government and the provinces. So we now have mainstream media asking the federal government, for example, about attaching strings or conditions to federal funding to the provinces and territories. So I do think it's opened up a conversation now about the importance of that. Long-term care has created that space. There are a range of conversations happening now federally about childcare. And so I do think that this is an opportunity that we can embrace where there is a kind of renewed interest in that particular question you're asking about.
Christine, do you want to add to that? Well, I mean, I would just say that the imperatives that come with the kind of investments that are needed require our federal government to do much more, and working with the province and with the municipalities, which also opens up that window. I think our federal government, while we can't say they're actually able to print money, it's pretty near there, and our provincial government certainly doesn't have the capacity to do that. So we do need to see more funding. We needed it prior to the pandemic. There's been an erosion of the kind of percentage of supports that have funded whether it's our healthcare system, whether it's our post-secondary education system or otherwise, and that the strings attached obviously has been eroded. So I think also the fiscal imperative means that there is an opportunity here as well. kind of, increase that the shared governance and the cooperation across the country, across levels of government.
Yeah, I think it's important to know, we often hear governments talk about the constitutional jurisdictions of the division of powers between the federal and the provincial government. But we have seen in the past as well where the federal government, provincial government have worked together to achieve really big social policy goals, particularly with the creation of Medicare, where the federal government has been able to come in with the funding necessary for the province to deliver what is in their jurisdiction. Certainly, as we have as we continue the conversation around long-term care, we are going to need to see the federal government lead in this, particularly around the financial tools that are necessary to bring long-term care into the public health provision. We have to have the provinces see the benefit of this as well. We have to make sure that they are recognizing that the federal government does, as Tammy and Christine have mentioned, have the policy tools and the fiscal tools to be able to implement this. So I think it's important that we continue to push and show that we have achieved this before. We do have some comments coming in that I think will draw out some conversation as well. So again, the idea of childcare workers from the federal government is finally listening to childcare advocates during this pandemic, and has highlighted the need for increasing funding. Again, we've talked about childcare as an important social tool, social policy tool. But maybe Tammy, I'll come to you just to draw that out on why is childcare not just an important social policy tool, but an economic tool in terms of moving into the recovery and moving out of the pandemic.
Well, I think that is another way where we're seeing new openings created to have important policy conversations. So as we talk about people re-entering the labor force, there is now a conversation about how people cannot do that without childcare, right? And so people's labor market participation rests on having quality childcare services available. And so we already know there are all kinds of economic benefits to childcare. The pandemic has simply made those more obvious, right? Investing in childcare creates jobs. It creates all kinds of spin-off effects. And so as we enter into a recovery period and we're going to need economic stimulus, childcare is going to be a really important part of that plan moving ahead.
Thanks, Tammy. We have another question coming from Facebook, and I'll ask it and then we'll see who wants to answer. But we have seen the federal government, particularly with the creation of CERB, show that create that minimal income of $2,000 a month for folks that have been, again, affected by the pandemic and who are applying for that program. Yet, as we look at our income assistance programs before the pandemic, we were well even below that threshold of $2,000. So is there a way, again, and the question coming from Facebook is, how do we hope that the acknowledgement of that income support from the federal government influences or starts to show that, in fact, we need much more in income support for vulnerable people in Nova Scotia?
Perhaps I'll take that one, Alec. Yeah, I think it is one of the positives that has come out of this. Obviously, we needed the income supports in place in order for people to be able to self-isolate, in order for people to, if they weren't an essential worker, to not go into the workplace. They needed that income support. And that our federal government chose $2,000 a month is interesting. Interesting is probably not the best description of that, but it is a threshold that, as you say, is way higher than anybody on income assistance across the country. And in our own province, it's it's almost $1,200 higher depending on your circumstances, but as an individual, and so it does set a higher bar for what is a minimum amount of support that's required. Our income assistance program is the program of last resort for people. But the other thing that the CERB, the CERB, has done is it is better than employment insurance. So when we step back and we say, we've not done a very good job of taking care of people who need support, who can't go into the workplace. But even for those who have intermittent breaks from the workplace, we know that employment insurance had been eroded, that only about 40% of people were even getting access to that fewer women were getting access to it, that it is shining a light on the fact that we do need, as we've outlined here, to really consider how we can provide supports that actually, one, provide this minimum amount of income that's at a higher level, that recognizes what it actually takes to be lifted out of poverty at a minimum, but that also that people need to get access to the public services that they need as well. If we don't bring in things like rent control at the same time, then we won't be helping people so much as helping landlords continue to be able to just kind of increase the rent. So I do think that more people are hearing how inadequate income supports are that are existing, and how unfair it is that we've brought in this new higher kind of bar on income supports, and now we need to figure out how we can take that information and more people can ask for people to be lifted out of poverty. That's really what we need to be doing.
Just to add to that, in the framework, as Christine just laid out, we talk about the need for addressing income and public services. And so I teach courses on social policy, for example, and we talk in those classes about how we used to talk about the idea of a social wage, right? The social wage is the idea that we need public services so people can rely less on the market for their survival. And so I think we need to keep in mind that public services are equally important when we're talking about income.
Thank you for that clarification, Tammy. Yeah, absolutely. They need to be complemented together. We are out of time, folks. I do want to just give final thoughts, and I think I'm going to come to Christine for 30 seconds of final thoughts. If there are questions that are continuing to come in, we'll do our best to respond to them on Facebook at this point in time. But I'm going to, again, allow Christine to wrap us up, and then we'll say goodbye for today.
Thanks so much, Alec, and thanks, Tammy, and thanks for collaborating on this work. My final thoughts really are about what our main points are. So what we want to hear from government is, one, you're talking about reopening the economy. What we need to hear is how workers will be supported so that they do not have to make a choice between their health and their income. That's critical. They need to be fully supported to do the work, and they need to be fully supported so that we, whether we are workers, whether we are consumers or service users, that we will have the confidence necessary to quote unquote reopen. So in order to have that happen, we need those supports in place. We need our workers to be protected. We need them to be fully supported, so they don't have to make that choice. And if they're not making that choice, then we will have the confidence necessary. And secondly, if it's not clear from the title and not clear from what we've said, we need our social safety net transformed. We need to do better at taking care of those who need care: children, the elderly, those who are sick, those with disabilities, and those unable to work. That means income supports, but it means universal pharmacare. It means public long-term care. It means home care is deemed essential and publicly funded. We must invest to build a universal child care system, a strengthened public education system, more affordable, if not free, post-secondary education, more adequate and more affordable, if not free, public transportation, and communication technologies we are now seeing, and we knew before, but we now know more so they are essential. And if there is not a profit to be made, then we need our governments to lead to ensure that people have access to communications technologies. And certainly last but not least, we need to address the problems in our food systems. And that includes supporting our farmers. But as we've said all along, food security is really about income security as well. So let's circle back to that, transform our social safety net, and ensure that people are supported to make the best choice possible for their health and for our health.
Thank you so much, Christine. Again, it's clear to me, and I think I'm hoping to many as well, that we can't go back to normal, and we have to stop using the language of going back to normal. We have to forge a new path forward that supports all of us to be in this together, and truly in this together. We must leave no one behind in the reconstruction phase as we build a green, sustainable, just, and fair society. So are you with us? Will you join us in this task? We have to be able to hold governments accountable and to organize and mobilize using these principles. As we wrap up today, I want to thank both Tammy and Christine again for their ideas, their commitment, and their being willing to continue to talk about these ideas. I also want to thank Govind Rao, who's been helping us in moderating questions today. And thanks to everyone who tuned in. We aim to continue to do more of these in the months to come and to continue to bring ideas into the public discourse. This is the time where I do mention that the CCPA is a not-for-profit charity, and we do rely on donations from supporters in order to continue this good work. If you are in a position where you can give, you can log on to our website, to the Donate CCPANS Research Fund. And leave us a donation. 100% of those donations come back to our local office and our local work, and of course are fully tax deductible. I want to ask everyone and welcome everyone to stay safe and healthy, and in solidarity we will sign off and look to see you again soon.